Alright, my name is Brian. I'll be performing head-to-toe assessment. I'll be using my pillow as my patient. And we'll get started. Okay? So, knock knock, hand hygiene. Provide privacy for the patient. I'm gonna have my patient facing me so I can face the camera and the patient both at the same time. It'll be a little bit easier. Wonderful. So, hand hygiene. Can you tell me your first and last name and date of birth, please? Then I'll go and check the wristband and see if it matches what the patient says. And how do I to be called? By your first name or by Mr. Pillow? And he says Mr. Pillow. I'm calling him by Mr. Pillow. So Mr. Pillow, I'm gonna be performing head-to-toe assessment on you today. I'm gonna be checking overall health of your heart and lungs, see how you're doing. Will take about 15-20 minutes at the most. And thank you for letting me take care of you today. It's a pleasure for me to do so. And as I walked in the room, I did a survey check where I saw any hazards or spills on the floor for the patient. There's none for this patient. And I'll check all the 4 brakes of the bed are on, side rails are up, and I trace, if you are an IV for the patient, I trace the tube and see which fluids be given to the patient at which rate. And I'll inspect any dressings, IVs, tubes, and drains. And I'll also notice the patient seems to be happy, collaborative, good hygiene, and good appearance. Perfect. And Mr. Pillow, can you tell me, actually I'm gonna start with a set of vital signs, and then I'll grab my blood pressure cuff, put in the patient's right arm, it's 120/80. Then I'll go and see the patient's radial pulse and respiration rate. And go and do that for 30 seconds. Respiration for 30 seconds. I can dock 1 minute from my time. I'll take a full minute to do so. So radial pulse will be 80. Respiration 12. I'll take a thermometer and see the temperature of the patient and see it's 98 Fahrenheit. And get a pulse oximeter and put in the patient's index finger. It's a 92% oxygen saturation, room air. There's no oxygen being given to the patient currently. Perfect. Are you feeling any pain today, Mr. Pillow? And he says no. But if he would say yes, then I'll say, I'll ask the PQRST questions, but it's not necessary for this patient specifically. Alright, and Mr. Pillow, can you tell me who you are, why you're here, and where you are? And he'll say, my name is Mr. Pillow, I'm in Brian's bedroom, I'm here because he's performing head-to-toe assessment on me today. Wonderful. Gonna be checking so the patient's alert, oriented ×3. I'm gonna be checking your eye reflexes. We shine a little bit of light on both eyes, one at a time, and as I do so, just look straight across to me, okay? So I'm gonna go over here and tap on the patient's eyes. Patient's eyes. And Mr. Pillow, can you look really close to me at this pen? And he'll look, and then now can you look at the object right there in the top of the wall? Perfect. And this is a 4. So both pupils are equal, round, reactive to light, accommodating, and pupil size is 4 millimeters for both of the patient's pupils. Mr. Pillow, going to be checking sensation. If there's any sensation loss on your arms and legs, I'll be touching your both arms at the same time, and then later your both legs at the same time. And you tell me if yes, you're feeling this or you're not feeling this, okay? As I do so, then touch both arms. Feel this. Can you feel this? Can you feel this? Can you feel this? And feel this? And feel this? And the patient says yes, I can feel everything. So there's no sign of sensation loss, and for extremities of the patient, no signs of neuropathy. Perfect. I'm going to be checking, Mr. Pillow, checking the strength of your hands and feet. And starting with your hands, can you grasp with your both hands those fingers over here? And then go and grasp it. So bilateral strength for both hands of the patient. And with your feet, ask the patient to dorsiflexion, pull his feet towards himself. And put my hand as so there's something to see the strength of the patient. And he goes and pulls his feet as my hands kind of blocking the way, as doing resistance. And then I say bilateral strength for both of the patient's feet. Perfect. And then notice the patient doesn't have any hearing aids or no problems with speaking. Notice as well the patient's breathing pattern is effortless. He's not using any accessory muscles. It's not shallow, it's not too deep, it's normal pattern, normal depth. And Mr. Pillow, can you tell me if you have been coughing a lot recently? He says no. Can you demonstrate coughing to me? And he go, so no problems with coughing. And when you do cough, is there any yellow or green stuff comes out of the cough? And he says no. So it's non productive, no formation of sputum. And if you were to question about frequency, amount, color, and such, and consistency. Alright. If you are needing scintillating spirometry order for the patient, I'm going to check on that right now. There's none for this patient specifically. Mr. Patient, I'm going to be auscultating your lungs and your hearts right now. So I'm going to ask you to move forward a little bit so I can go on your back and hear your lungs, okay? Okay. And now ask the patient to do a deep breath as I do so here. Deep breath, deep breath, deep breath, deep breath. And same thing with the thumb. Deep breath, deep breath, deep breath, deep breath. And then go forward. Let's pretend this is the anterior position or frontal ventral position of the patient. This is S1, S2, apical pulse. Wonderful. Mr. Pillow, all your lung sounds anteriorly posterior clear. S1, S2 is normal pattern, normal rhythm, no murmurs noted. Your apical pulse is +2 as expected, is no murmurs noted, and normal rhythm. Then I'm going to check both the radial pulse at the same time. Both of those two are bilateral equal, +2, normal rhythm. Post-tibial bilateral equal, +2, normal rhythm, and dorsalis pedis with +2, bilateral equal, normal rhythm. And now notice the temperature of the first extremities are warm to touch, normal color, no cyanosis. There's no sign of edema for this patient. I'll do capillary refill, do a little pinch. And then in both hands, both feel the patient less than 3 seconds, capillary refill for all the extremities of the patient. Wonderful. Mr. Pillow, gonna be just auscultating your gastrointestinal system, your stomach, okay, and see for presence of bowel movements. I'm gonna go all the 4 quadrants, each one at least 30 seconds. Wonderful. So presence above bowel movements, all the 4 quadrants of the patient, and Mr. Pillow gonna be palpating some regions of your abdomen for a minute, just to see signs of pain, tenderness, or there's anything that's not supposed to be, or if everything is normal. Okay, they'll do a palpation. Boom, boom. Let's pretend this is him. Here, here, here. And you let me know, please, if I touch, do you feel pain? Do you feel pain over here, and here, and such? Awesome. So no signs of tenderness, distension, ascites in the patient's stomach upon palpation, and in all the 4 quadrants. And the patient has a normal contour for the stomach and abdomen, healthy for the patients. Mr. Pillow, can you tell me if you have any problems eating recently with appetite and nutrition? And say, no, I've been eating everything they give me here in the hospital. Wonderful. Any problems with nausea and vomiting by chance? No problem with nausea and vomiting. Any problems passing gas by chance? No problems passing gas. Passing good, perfect. Any problems swallowing food? Say no. Can you demonstrate to me how to swallow your swallowing goes? So no problem swallowing, no problem with aspiration, such. When's the last time you went to the bathroom to defecate? He said it was yesterday morning. Okay, and when you did so, do you remember the amount? It was normal, a lot, or just a little? He says normal amount. Tell me the color, like a brown, dark brown, or not too brown. He says, oh, it was a normal brown. And can you tell me the consistency was like really hard or really soft? He said, no, normal consistency, not too hard, not too soft. Perfect. Okay. With urination, when's the last time I went to the bathroom to urinate? Say it was this morning. Can you tell me the amount? It was just a little bit, a lot, or too little? And he says just normal amount. Can you tell me the color? Was a straw yellow or dark amber yellow? And he says a straw yellow. Can you tell me if it was a clear, cloudy? And he says clear. Can you tell me if it had a weird smell, like a foul smell? And he says no, foul smell, perfect. In a normal day, how many times you go to the bathroom to urinate? And he says 6 times, okay? Any problems with urgency where you cannot hold yourself and you just urinate? He says no. Any problem with hesitancy where you have actual problems urinating? He says no problem with hesitancy. Any problems with burning feelings or discomfort with urination? He says no problem with those. And the patient is voiding regularly, is not having problem with continency or anything like that. Perfect. Mr. Pillow, do you have any problems in changing yourself, grooming, getting ready for your normal things, any of your normal activities? Have any problems with those? And he says, no problem. I can change myself, can groom myself, can bathe myself. Wonderful. Any problems with mobility where you have to use a walker, a cane, a wheelchair? And he says, no, I can walk and no problems with mobility. Have you recently fell at home at your own house? And he says, no history of falling. So the patient's not at risk for fall. And I notice the patient's skin is intact. There's no wounds or anything is intact. It's dry, it's not moist. And Mr. Pillow, I'll check for skin turgor, which means just skin elasticity. I'll do a little pinch below your neck and your arm for a second if you're okay with that. Then go do a little pinch there, a little pinch here. And you see how the skin goes back to normal fast, so it's normal turgor, normal elasticity for the patient. And Mr. Pillow, I'll check some of your pressure points in the back of your head, elbow, this region over here, and back of the heel. So would you mind sliding to your left for a second? The patient goes brows to left and then go check back of the head, elbow, this region, back of the heel. There's no signs of pressure ulcers for this patient, and the patient is not at risk for having pressure ulcers. And I'll notice as well the patient has normal hair distribution, healthy nails. I'll actually grab on the hand and see the bad signs of the clubbing. There's no signs of anemia for the patient. Normal hair, normal skin, normal nails. And Mr. Pillow, thank you for letting me take care of you today. I'm gonna document all those findings in the electronic chart. I'm gonna put your back in the lowest working position. Bring our belongings with reach. Call lights with reach as well. If you need anything, you can press a light, and I'll be more than happy to come back and assist you with anything. Then I'll go to the electronic chart, document everything, hand hygiene, and thank you, Mr. Patient. Have a wonderful day.